Healthy Lives, Healthy Futures is an ongoing review of health and social care services across northern Lincolnshire. Our aim is to try and ensure that the population of northern Lincolnshire have access to the best quality services that are available anywhere in the UK in a sustainable way going forward into the future. As a result of this review at this point in time, we're proposing two major changes to hospital services. The first is hyperacute stroke services and the second is inpatient ear, nose and throat services. We've engaged with the public through a formal consultation period over the summer, which in total has lasted 3 months. Against each of the two services, we considered 4 options. We came up with a preferred recommendation and gave our rationale for why that was our preferred recommendation. We've now finished our consultation period. In response to this formal consultation, the 2 CCGs within northern Lincolnshire have made a decision to go and implement their preferred options. The consequences of this decision with respect to the whole stroke care pathway means that the temporary arrangements that were put in place last year will now become permanent and remove a significant amount of uncertainty. In practice, that means that if you're suspected of having a stroke, for the first 72 hours of care, that will be delivered from the Scunthorpe Hospital site, where we have a team available 24/7 with the right imaging facilities available. And then if you live within North East Lincolnshire or the wider Lincolnshire area, you will go back to your nearest hospital to receive your ongoing care. The basis for making this recommendation with regard to stroke was that we tried last year to be able to maintain 24/7 services at both Grimsby and Scunthorpe hospital sites. We were unable to attract staff to be able to fill the rotas. This meant that actually patients could receive hyperacute care, but only in hours Monday to Friday, and clearly that was not acceptable. With these new arrangements, it doesn't matter whether you have a stroke in the evening or at weekends, you'll get the best quality care. Healthy Lives, Healthy Futures is all about improving the quality of care for patients within northern Lincolnshire. The temporary arrangements that we've put in place for stroke has actually meant that our mortality rate has fallen from 14% to 11%. We've moved from having some of the worst outcomes in the country to now having some of the best. To put that into context, 22 people are here with us now this year who would have died under the old arrangements.
Most ear, nose and throat patients in northern Lincolnshire will not actually see a difference in the way their care is provided. We will be maintaining outpatient appointments at both hospitals, both Scunthorpe and Diana, Princess of Wales in Grimsby, and day surgery will be done at both hospitals. The only difference will be that people requiring a hospital stay due for an operation, this will be located in Grimsby at Diana, Princess of Wales. The vast majority of ENT operations are day surgery, so only a small number will actually require an inpatient stay. If somebody attends Scunthorpe Accident and Emergency Department with an urgent ear, nose and throat problem, they will be directed to Grimsby to seek specialist investigation and advice. There has been concern that we haven't been able to provide 24/7 specialist consultant cover at both sites. This would mean that if a patient required urgent care and the cover was at the other site, the patient would have to be transferred, which is obviously distressing for the patient. Although most ENT surgery is planned and routine, unfortunately occasionally emergencies do arise. We have therefore made the decision to centralise the service at Diana, Princess of Wales. We can therefore provide 24/7 specialist consultant cover and provide a good, safe, quality service for all our residents of northern Lincolnshire.